Hey everybody, Nate here, Hill and Ponton's video guy. Today I'm with Rachel Cheek and we're going to talk about leg flexion. Is that correct? Leg flexion?
Knee flexion.
Knee flexion specifically. Look, I'm already messing things up. Now, instead of me jumping right into the video, I want to remind you guys to hit the thumbs up and subscribe as well. We would love to have a ton of people watching these so we can make sure that this free information gets as far as it can. Now that I've done all the upfront stuff, hey Rachel, you ready to talk about knee flexion?
Born ready.
Awesome. So knee flexion, what is it? Let's jump in. Let's just define it first.
Sounds good. So when we talk about knee flexion in the context of VA benefits, we're talking about limitation of motion. So the knee is interesting. This is one of a few joints throughout the body that you can actually get multiple ratings for the same knee, depending on how your motion is limited. I would say limited flexion is probably the main one that we see this a lot. So think about like how your knee is. If this is, I'm not so double jointed anymore, but flexion is, how far you can bend your knee,
Okay.
essentially. If your flexion is limited, you can't bend it all the way. And depending on how limited that is, as you imagine, that can interfere with walking, that can cause pain, it can cause problems like going upstairs,
Mhm.
navigating uneven terrain, even sitting, depending how limited your knees are. If you can't bend them very far, you might be better off laying down.
Mhm.
I've talked to veterans who have that. So flexion in specific, again, is how far can you bend your knee? I don't have the numbers in front of me. I can't recall the exact ratings. I'm not that good off the top of my head, but essentially, um, when you're rated for limitation of motion, flexion in the knee, what happens is you go to an exam or you have a doctor that will do this and prepare a report for you where they measure literally how far you can bend your knee. They have a little tool and it will say the amount of degrees that you can bend your knee. They'll note that on the form. And depending on how limited your flexion is, depends on how high your rating is. You might imagine the less you can flex, the higher your rating is. Something to consider that with knees, a lot of times, even me, when I think about knee ratings and I'm talking to veterans, I think about it in the context of arthritis,
Mm.
because you see that a lot, like knee arthritis. Your joints get creaky, you can't bend them, you might have had damage to them. It might be an old injury. So that's certainly somewhere that you'll see knee flexion get brought into the picture. But something I was thinking about preparing for this was that arthritis is not the only way that you can injure your knee or have limited flexion. So think about like, and if you had an injury to your knee, like a scar,
Yeah.
like if you have a certain say you had an injury to like the back of your leg and you ended up with scar tissue or muscle injury and you can't bend it anymore because of that, even though it's a skin condition, a scar causing that, you still should be rated on your limitation of motion if you can't flex. It doesn't matter what caused it as long as the condition is service connected.
And so when it comes to knee flexion, have you had any cases that you've worked on that have? Yeah,
Yes.
a lot of them, it seems like.
Yes,
Okay.
certainly.
So are there any stories that stick out that something interesting that happened or a different way of approaching it that you did?
That's a good point. Or sorry, good question. Different way of approaching it, I would say, is just kind of thinking outside the box, not limiting it only to an injury to like the arthritis, like the bone.
Mhm.
Thinking about it. Well, now I can't think of it. I had other examples actually.
Because there's a lot more. There's like cartilage in there. There's a whole bunch of things within the knee that could be your kneecap. Like
Mhm.
there's a lot of things that can mess with it, as well as probably even the muscles around it that could affect it. So it's a lot more than just the arthritis of the knee.
Exactly. And I'm glad you mentioned other knee conditions, especially with the cartilage,
Yeah.
because so VA acknowledges like the knee is an important joint. So not only can you get measured on or rated on the limitation of motion just of your knee itself, but you can also get rated on a meniscus tear, so a tear of that cartilage and that muscle in your knee. You can get rated for an injury to the patella, the kneecap itself. You can get rated on instability of the knee. That's something that's big. If you ever have like an ACL tear or something like that, I once popped my knee out doing yoga. I don't know how, the least active activity I could be doing. But you'll know if you've ever done that. You do it once, it's way easier for it to happen again. So a lot of times I'll see veterans who had like an ACL tear or something during service, and they've continued to have their knee popping out of place and feeling like their joint is just not stable ever since. So for that, actually, VA can give you a separate rating. So you can have both limited knee flexion and instability,
Hmm.
depending on your specific diagnosis. And you can also have a rating for limited knee extension. So you talk about flexion, bending, extension, straightening it out.
Yeah.
If you have an injury, I'm not a doctor. I don't know, to the front of the knee, to the back of the knee. I don't know where it would be, but
Yeah.
in some way that would limit you from stretching your leg out all the way. Just like we talked about with flexion, that limits your ability to walk, to go upstairs, to sit, probably to lay down. I know I've talked to a lot of veterans with knee issues, and the things that they do to have to accommodate
Mm.
is just, it's hard to think about it. Like when you're not dealing with it day to day,
Yeah.
like having to lie down, my dad would love this, but having to lie down in a recliner, like, these clients,
Yeah.
they can't use normal chairs. They can't, flex their knees back, or they'll have to change position frequently.
Yeah.
There's just a lot of adjustments that you have to do. I've talked to veterans who moved houses to go from having stairs to having none. Um, just because of the limitation that if you've got problems with your knees and you have a second floor of your house,
Yeah.
you're gonna limit your time up there or downstairs. Either way, it can really affect your life.
Now, do you usually see this as a primary service-connected condition or a secondary service-connected condition?
Oh, that's a good question. I would say mostly primary.
Okay.
Um, Following either a direct injury or injury over time.
Mhm.
So a lot of times I've have several veterans who didn't have a direct injury to their knees in service, but the type of work that they did basically aged their knees way faster
Yeah.
than if they hadn't done that work. So for example, like if you're engine mechanic and you're kneeling and you're getting up and down from the ground. I've talked to Navy veterans who basically had to like crawl to like do certain repairs. Also, veterans who worked on Navy ships, huge Navy ships, and are going up and down and up and down and up and down the steel ladders with no
Mhm.
padding for years, however long they're on that ship. Um, there's just a lot of factors that can, you might not think of it at the time, but it can cause you problems later. Carrying really heavy rucksacks, doing different types of physical training or drills, you know, being out in the field, like no training, you're just out there for real. You're carrying all your stuff on your back. Certain jobs, it wasn't just carrying your pack and your equipment, you're lugging like wire spools and communication equipment. So there's a lot of different things that, again, you don't think of it at the time, maybe there's not a direct injury to your knees, but the activities that you did during service, if you hadn't done those and it had just had, the office job that you had in your civilian life, that probably wouldn't be happening.
Yeah. Now, since you've worked with a bunch of knee flexion cases, what are some tips that you can give someone who is in the beginning stages of filing for it that might help them avoid the getting denied process of working with the VA?
So I would say either if you did have a direct injury in service, they may or may not have been noted in your service records, but definitely check there first. If you know that you had an injury, sprain, anything like that, definitely check your service records first. If you have documentation, that is great. Doesn't mean VA is going to grant it.
Mm.
So, what I would also suggest is a statement about how your knee pain continued during that time in service all the way till now. What did you do to treat it in the meantime? In the years between this happening in service and now, what did you do to treat it? Did you take over-the-counter medication? Did you do physical therapy? Did you wear braces? A statement from a friend or family member can always help as well. Showing when you do a statement from a friend or family member, you want to only have them talk about what they observe.
Hmm.
So this is something I always tell veterans when I'm doing a statement is, you want to talk about your personal experience. So if it's a friend or family member that's helping you with this statement, it's not good enough to just say, the veteran is in pain. How do you know that they're in pain? I can tell that the veteran is in pain because when, he gets up, his knees crack and he screws his face up. He walks without bending his knees very much. That type of detail is helpful. And again, just because you didn't have a service, if you didn't have a documented in-service incident, I don't want people to think that means that it bars them from ever applying.
Yeah.
Late statements are great here. And like I spoke about, if you did heavy duty work that was hard on your knees, hard on your legs, kneeled a lot during service, definitely make a note of that. VA has your records, but is there a guarantee that they're going to actually look through and say, oh, what does this MOS mean? We should look it up and see what this entailed. They're not going to do that. So lay out the information for them, for the VA, that is, and of course, any contemporary medical records that you have. Current diagnosis is the first step. I should have started with that.
Thank you guys so much for watching. If you have any questions on knee flexion or knee extension, click the link in the description below. It has an article that talks all about it. And as always, thank you for watching and thank you for your service.